Hello, Assalamu alaikum. It's me, Dr. Naseem Sherzad, and today I'm going to discuss with you all the minimally invasive treatment option called the Urolift for the treatment of enlarged prostate. So, Urolift is a minimally invasive procedure in which we are placing a permanent, non absorbable and coring suture that we are place it endoscopically into the lateral lobe of the prostate. And it works by compressing the lateral lobe of the prostate to make a prostatic urethra patent. So this is the mechanism of action of the Urolift, that it is a permanent suture having a spring loaded in the mat and it is a T-shaped. The suture is placed on tension, and once activated, the lumen of the prostatic urethra toward the capsule and keeping the prostatic urethral opening. This is important as I have shown in the picture that it is a T shape. The one part is out of the capsule and the other is inside the lumen, and the mid portion of this T shape is spring loaded, and it causing a stretching effect, and it stretch the prostate toward the capsule away from the lumen. Now the question is that how many it is performed under local anesthesia or into sedation in the office-based procedure, as it is performed as a daycare procedure. How many implant is to be installed? So the number of implant is dependent on the adenoma size and configuration, but we are ranging that's from 2 to 10, and that is typically placed in 2 o'clock and 10 o'clock position, and it is angled anterolaterally, and it is at least 1.5 centimeter distal to the bladder neck in order to preserve the integrity of the bladder neck. So the as compared to with TRP, the main problem with Urolift that it is not does not collect any tissue specimen and therefore cannot pick up incidental cases of the prostate cancer. So as compared with TRP, you will be unable to get any specimen to pick up any incidental cases of prostate cancer. Now the other question that what is the Urolift made of? The implant are made of stainless steel, and the suture is made of a special metal known as nitinol, which is a super elasticity quality and shape memory. So the main thing which you are using in it, that is the nitinol. What are the indication of this Urolift procedure? The indication for Urolift is the medical therapy palaver, the patient having multiple comorb, and a patient who want to preserve his sexual function. So these are the indication for Urolift. Previously, it was thought that the Urolift cannot be performed for median lobe, but now a lot of study coming, and it's saying that the Urolift system can be used to treat a broad spectrum of anatomies, including the obstructive median lobe. So previously, it was contraindication for Urolift, but now it can be performed for an obstructive median lobe. The contraindication for Urolift include the prostate size more than 100 gram, the urinary incontinence due to incompetent sphincter, the patient currently having gross hematuria, or the patient having active urinary tract infection, or the patient having urethral structure. These are the various contraindications for Urolift. And what are the advantage of this Urolift? The advantage is short hospital stay, there is no blood loss, there is low rate of local symptom, preservation of sexual function, and it is easily or simply to perform. What are the complications of the Urolift? The commonest complication of Urolift is hematuria. It can cause dysuria, it can cause pelvic pain, urgency, and transient urinary incontinence. Procedure which should not be performed in the presence of median lobe, that is TUIP. Urolift now can be performed in the presence of median lobe. And The other procedure which can be performed to preserve sexual function include prostatic artery embolization, Urolift itself, and the transurethral microwave treatment, transurethral needle ablation, and resin. These are the procedure which can be performed for a patient who want to preserve the sexual function. So this was all the detail regarding the Urolift, and I have shown the picture in a detail.